To be plenty of good reasons to continue wearing masks if COVID-19 is eradicated through a vaccine. Wearing a mask shows solidarity and caring for those who've become ill with COVID-19. But in South Africa, one of those reasons is particularly TB. TB researcher Helene-Mari van der Westhuizen has contributed to Bekisisa Center for Health Journalism, and she joins us now live from Oxford. Helen, it's a pleasure to have you with us this evening, and thank you so much for your time. Look, it's not good news hearing that we should potentially keep wearing masks because we could be protecting ourselves and others even more. Tell us why we need to think about this beyond COVID-19.
Yes, Kathy, you're absolutely right. TB is an old disease, but just because it's familiar doesn't mean we've quite figured out how to prevent its spread. And so TB in South Africa has been and continues to be the leading cause of death. And for several years, we've been using masks to prevent the spread of TB in South Africa, but we've been mainly focusing on people who we know have TB, or if you visit a health facility with TB symptoms, you might be asked to wear a mask. However, a recent study came out and showed that 50% of people with infectious TB may not even have any symptoms. And so that means that we've been placing the emphasis at the wrong place. The second component, because we've been using masks for people with disease, they were quite a stigmatizing object. People didn't enjoy wearing them in health facilities. It was almost like wearing a label, shouting to everyone, "Hi, look, I've got TB." So now with COVID-19, of course, that has changed. We've gotten used to wearing a mask. And I think that gives us an opportunity to move away from asking specific people to wear a mask, to identifying the high-risk places where it would be important to wear a mask to protect others. And places that come to mind would be taxis, healthcare facilities, basically places where a lot of people are cramped together and the ventilation isn't good.
Sure, and you know, you're bringing up this idea of how perception around wearing a mask is, because I would imagine that before COVID-19, if somebody walked into a private space with a mask on, those that they were visiting would probably feel insulted. They probably think, what does this person think is wrong with our space? And do you think that that might change after COVID-19? And so, you know, when you talk about wearing a mask in a taxi, it could very much be seen as that the people around you might think, oh, so do you think there's something wrong with us? You know, is there a smell that's going on here? Why is this person, you know, trying to do it or behave in this way?
Yeah, Kathy, I think you're absolutely right. I think that the meaning associated with wearing a mask has changed. And so I think there has been a shift from seeing a mask as a medical tool, something that's associated with a disease, to something that could match your outfit, that perhaps also sends a message of solidarity. I think especially messaging like "my mask protects you" and "your mask protects me" emphasizes the social norms that also influence how we wear masks. And I just think that creates a huge opportunity for us to use that for TB as well. So far, the impact of COVID-19 on TB has been devastating. There's been fewer TB tests done, and the latest TB incidence rates that have been reported were much higher than anticipated. So masks could very well be a silver lining for what has been a very negative impact on the burden of TB in South Africa.
I suppose because you've mentioned public transport as one of those reasons, it becomes then not really possible for everybody to avoid the spaces where there could be a high potential for TB infection.
Absolutely. And so if we look at places that are hotspots where TB is spreading, those are, for example, taxis, healthcare facilities, basically spaces where there isn't a lot of ventilation. I think what is also important to realize, and there is a common misconception that TB only affects people who have certain risk factors, but that is actually not true. Although they can make you more likely to get TB disease, all you need to do to be affected by TB is basically to breathe. And so COVID-19 and also TB forces us to ask, how can we make our shared air safer? And so masks is one of the valuable tools that we can use. Other things to look at could be ventilation, and so that could be high-tech or low-tech solutions. So low-tech could be making sure the windows are open, making minor building adjustments. And the high-tech solutions looks at things like germicidal UV or maybe some HEPA filters. And then other tools to help us get control of the current TB pandemic would be just to make sure people with TB symptoms are able to access diagnostics and they get support as they go through their TB treatment.
Let me thank you so much for your time on the Pulse tonight. And that was Dr. Helene-Mari van der Westhuizen. You can read about her research on the Bekisisa website. Our President Cyril Ramaphosa